I'm Dr. Manohar, discussing about the drugs used in COVID and their mechanism of action. COVID is a pandemic infecting more than 25 lakhs individuals and death rate around 6.89, and you can see the recovery is around 25.72%. So though there is no drug or currently approved for the COVID-19, so we can use various antiviral drugs like interferons, Ribavirin, Arbidol, all these which are previously used in the treatment of hepatitis C virus or influenza virus, etc. Apart from this, we can use antiprotozoal drug like chloroquine, antibacterial, antibacterial and antihelminthic drugs even. So we'll go for drug by drug. So first, interferon alpha. Interferon alpha is consisting of 165 amino acids. It is a alpha binding to type 1 interferon and it activating the JAK-STAT pathway. It enhances viral production. So translocation of ISGF complex, which initiates the antiviral protein. Lopinavir, Ritonavir. So these are the previously treated for the treatment of HIV infections. So normally the mechanism is by inhibiting the protease. So protease enzyme is essential for the cleaving of various proteins of the viral, which properly enveloped in the virus and form a new virion. Ritonavir, it enhances the activity of protease inhibition by blocking a specific metabolizing enzyme CYP3A4. So the activity of lopinavir is enhanced. Arbidol, the drug claimed to inhibit the viral entry into the target cells and stimulate the immune response. This molecule has the affinity towards the ACE2 receptors, and it stimulates the humoral immune response, induces the interferon production, and stimulates the phagocytic function of the macrophages. Ribavirin, it's a prodrug which metabolizes resembling purine RNA nucleotide. It is a guanosine analog used to stop the viral RNA synthesis and viral mRNA. It interferes with the RNA metabolism required for the viral replication. Ribavirin enhances the interferon activity and decreases the intracellular pools of nucleotides, and it causes the mutagenesis of the mRNA of the virus. Hence, the virus can be decreased. Remdesivir, it is analog causing their premature termination. It interferes with the action of the viral RNA dependent RNA polymerase and evades the proofreading by the viral exogenous. So you can see the similar structure ATP than Remdesivir. Because of the structural similarity, it inhibits the proteins in the virus. Favipiravir, it is it inhibits RNA dependent RNA polymerase, which is essential for the viral replication. So these are the different antiviral drugs used previously to treat Ebola, SARS or HIV and various different antiviral drugs. So we are doing clinical study by using these antiviral drugs, since the COVID also is a RNA virus. Next, other category of the drugs which are effective against the COVID are the antiprotozoal chloroquine. So normally this is an anti-malarial drug. It increases the endosomal pH and interferes with the glycolization of the cellular receptors of the SARS-CoV, and thereby it has the potential to block the viral infections. Chloroquine also inhibits the quinolone reductase, which is involved in the sialic biosynthesis, and it enhances the zinc influx. It's inhibit the RNA dependent RNA polymerase. So this typically the endosome is going to be endosome is formed because of the ACE2 receptors, the internalization of the virus. In endosomes there is you can see the drug molecule which enhances the pH, so resulting of that the protein cleavage is to be done. Antibacterial erythromycin. Erythromycin and azithromycin also can be used against the COVID-19. So here the basic mechanism may be the erythromycin, like antibiotics are a macrolide category. So these are highly basic compounds. It prevents the growth of the bacteria by inhibiting the protein synthesis, majorly by blocking the 50S ribosome. So here the erythromycin may act by inhibiting the mitochondrial protein synthesis, which is essential, which may essential for the packaging of the. And one of the most effective drug against the COVID-19 is ivermectin. Ivermectin is an anti-helminthic drug. It acts in as an anti-helminthic by enhancing the chloride channels, opening the chloride channels, and influx. It facilitates the influx of the chloride into the cell membrane. So hence the anti-helminthic activity can be seen. So coming to the virus, ivermectin is an inhibitor of it will form a complex with the importin, and it inhibit the translocation of the virion particles along with this importance. This is the diagram where the important 1A and important B is bind with the non-structural proteins, and it's translocated to the nucleus and inhibit the translation of various antiviral proteins. The ivermectin inhibit the formation of the complex, thereby it inhibit the translocation of this complex. Hence, the increased antiviral protein synthesis can be seen. Hope you understand. Thank you. Stay home, stay safe.